A new technology is evolving lung cancer detection and treatment at Ascension Sacred Heart Bay. It's called the ION Robotic Assisted Bronchoscopy System and Endobronchial Ultrasound. News 13's Grace Velez joins us live in studio. Grace, why is this technology a game changer for the hospital and the community?
Shelby, to start off, it's minimally invasive, and I know people hear that term a lot these days, but I got to scrub in and see how the machine works. And if you have a lung nodule and are in need of a biopsy, this robot gives a physician the equivalent of GPS directions straight to the nodule using a CAT scan or image of a patient's lungs. It speeds up the whole process while promoting precision. And pulmonologists say the ripple effect of efficiency is already being felt since the hospital introduced the state-of-the-art tech a couple of months ago.
Less OR time, less recovery, less cutting, things of that nature, and it would allow us to take a biopsy of a smaller nodule.
Dr. Megan Benedict says the ION robotic assisted technology has been a huge advantage, from shorter recovery times after a biopsy procedure to an earlier diagnosis for lung cancer.
We are doing things that are, less invasive, so there's less recovery time, there's less need for being in the hospital, less taking away from the usual things that you like to do in life.
It's essentially a GPS navigation. Dr. Benedict is the driver, precisely guiding a small catheter through airways to a lesion or nodule. Since they began implementing the technology with patients, Benedict says some procedures have taken as little as an hour with the patient in and out of the hospital in the same day. Dr. Benedict says if treatment is needed, the new technology helps them come up with a plan of attack faster. But it also helps them deliver good news quicker as well, helping to ease some of that waiting by the phone for the doctor anxiety.
It makes me feel very fulfilled in my job to be able to give an answer, or as you mentioned, the anxiety that's involved with knowing that you have a nodule, waiting, what am I doing about it? What should I do about it? Do I need to take a piece of it? All those unknowns allows us to get you answers faster, which I think brings a lot of relief.
Dr. Benedict says that expedited process has already allowed them to see more patients.
If we did not have this process and we did not have this technology, a lot of those patients that we have done the procedure on would have likely still been waiting.
The technology also helps provide crucial staging information for cancer. Overall, it helps doctors identify a problem quicker and figure out a plan of treatment faster, and can even help with early detection. November is Lung Cancer Awareness Month, guys. Ascension Sacred Heart Bay officials want this to be your reminder to schedule a low-dose CT screening, especially if you're between the ages of 50 and 60 or a current or former smoker.
All right, thanks, Grace. That's Grace Velez reporting live from our studio.